Okay, good morning. We'll go ahead and get started. COVID-19 continues to surge across our state and the nation. Over the last week, Iowa reported more than 21,000 new cases and had a statewide average positivity rate of more than 19%. Overall, 42% of new cases were among adults age 18 to 14, and 29% were among middle-aged adults ages 41 to 60. And in 88 of Iowa's 99 counties, the rolling 14-day average positivity rate is above 15%. As you know, a 15% positivity rate is a guidance that allows schools to move temporarily online with a waiver approved by the Department of Education. While the department has seen an increase in waiver requests, still less than 6% have been submitted since November 1st. Today, I've asked Director Ann Lebo to join me and provide some context about how schools are adjusting during this time. Ann.
So we are seeing an increase in the number of waiver requests to provide primarily remote instruction. Since November 1st, we have approved 24 requests, and we are in the process of reviewing and approving 3 more. The reasons for the requests are varied. Some are based on county positivity rates, student absenteeism, and in some cases, staff absences due to virus-related reasons. As the governor mentioned, this represents about 6% of our schools, with 446 public districts and non-public schools in 1,300 buildings. Schools do not have to wait until they reach both student absenteeism of 10% and a county positivity rate of above 15% to apply for a waiver. These guidelines are to assist districts when they are determining when they might want to use remote instruction, but they are only guidelines. The county positivity rate is just one factor that school districts and non-public schools should take into account, and it may not be indicative of the positivity rate among their students and staff. Each request to use remote instruction is reviewed on a case-by-case basis with our public health colleagues, and we have approved waiver requests that did not meet these specific thresholds. Our schools have put a lot of work into health and safety measures and mitigation strategies that have helped them manage conditions in their school environment. Because each situation is unique, school districts and non-public schools have a lot of flexibility to manage conditions in their schools and can always submit a waiver request at any time. Iowa's Return to Learn plans offer flexibility to operate during COVID in ways that do not require approval from the Department of Education and can be adjusted based on input from local school boards and feedback from students and families. Schools can immediately transition to remote learning for up to 48 hours while waiting for a waiver decision. Because the 50% in-person instruction requirement is based on a 2-week period, schools typically providing full-time instruction can also move to remote learning for up to 5 days without needing approval. Schools can also move 1 or more grade levels or sections of a building to remote instruction without department approval. Schools can make these local decisions based on local conditions and only need to request a waiver if they feel that closing an entire building or the district is the right decision for their community.
Thanks, Ann. And I want to commend Iowa schools for doing everything that they can to keep student and staff safe while making sure that learning continues. 3 of Iowa's counties with the highest positivity rate have experienced recent outbreaks in our state correctional facilities located there. The highest rate is 43% in Jones County, where there are currently 490 cases of COVID-19 among inmates at the Anamosa State Penitentiary. 484 are projected to move into recovered status this week of the 490. 254 inmate cases at the North Central Correctional Facility in Rockwell City has pushed the positivity rate in Calhoun County to 35%. Again, a majority of those, I think, are moving to recovered, projected to this week. And in Page County, where the positivity rate is 33%, the Clarendon Correctional Facility have had 440 inmate positives at that facility. I did have the opportunity yesterday to sit down with Director Skinner, who briefed me on the situation and has informed me that the second round of testing in these facilities are taking place today and tomorrow with the inmates that had tested negative. And as I indicated in the comments earlier, most of the individuals are moving to recovered status this week. Yesterday, 1,131 Iowans were hospitalized due to COVID-19. 89% were adults age 50 or older. Patients hospitalized where it is specifically due to COVID-19 account for about 15.2% of the census, and patients who test for COVID, but it's not the primary case, so all COVID patients, it accounts for about 21% of the census across the state. But the overall increased patient volume is stressing our healthcare system, and it is putting capacity at risk. Surge plans are in place, and while beds still are available for patient care, staffing them is becoming increasingly challenging as some healthcare workers may be sick or in quarantine or caring for other family members. The situation has the potential to impact any Iowan who may need care for any reason, whether for COVID-19 or for some other serious medical condition. And we don't want anyone to be turned away from our hospitals. As I said last week, these trends cannot continue, and it's critical that all Iowans do everything within their power to stop the spread of the virus now. Like so many states, we've reached a point of serious community spread, and we can no longer pinpoint any one age group or type of activity that's driving it. The virus is spreading easily between people as they gather together in groups or go about their normal activities, especially when preventative health measures like masking and social distancing aren't being followed. Because of the high level of community spread at this time, we're vulnerable to the virus even in casual gatherings with friends, neighbors, and extended family members. I know, again, as I said last week, we're all experiencing pandemic fatigue, but we just can't let our guard down just because we're getting together with people that we know or doing things that are most familiar to us. Even then, we're still putting ourselves and others at risk. The things that seem the least threatening are some of the highest risk activities right now, like wedding receptions, youth sports, even having some neighbors over to watch a football game. If we want to protect our healthcare workers, keep our businesses open, and our kids in school, and our hospitals open, now is the time for every Iowan to carefully consider what more that you can do to prevent being exposed to the virus and further spreading it. Since the beginning of the pandemic, I've said that I dial mitigation measures back up when conditions warrant, and that time is now. Today, I've signed a new proclamation that continues the public health emergency for another 30 days, and the proclamation imposes a number of additional public health measures to reduce the spread of COVID-19. Effective at midnight, any social, community, recreational, leisure, or sporting gatherings with more than 25 people indoors or 100 people outdoors will be prohibited unless all people over the age of 2 wear masks. Groups of individuals who attend these events together are limited to 8 people unless the group is from the same household, and all groups must still maintain social distancing from other groups at the event. Additionally, at indoor youth and high school sporting or recreational activities, only 2 spectators per youth athlete or participant are permitted to attend. The new 8-person group limitation also applies now at bars and restaurants, where distancing of 6 feet between groups will continue to be enforced, and patrons must be seated to consume food or drinks. Masks are now required to be worn by employees and customers at businesses that provide personal services, including salons, barbershops, massage therapy, tattooing, and tanning. Bowling alleys, pool and bingo halls, arcades, indoor playgrounds, and children's play centers are now required to ensure groups are limited to 8, unless, of course, they're from the same household, and all groups, again, must maintain 6 feet of distance while in the establishment. Reducing the spread of COVID-19 in the workplace is also critical. And while many employers have extended work-from-home status for their employees, I'm also ordering that all employers again evaluate whether more individuals can work remotely and enable them to do so to the extent possible. Finally, the proclamation strongly encourages all Iowans to consider how their actions impact the spread of the virus in their communities. I know that getting life back to normal is what Iowans want, and we've managed to get things back to normal already, even if they look and feel a little different yet. You can still eat in a restaurant, you can still go to a movie and work out at a gym, and in many states you can't do that. Iowa is open for business, and we intend to keep it that way. That's why it's time for these additional mitigation measures. But it will take all of us doing everything we can to stop the spread of the virus and keep it at a manageable level that we can live with. If we don't, we lose the very things that we've worked so hard to maintain. So I'm asking you to think about how you can make a difference, and it may mean making some really hard decisions. Please consider avoiding events where public health measures may not be followed, especially if you're someone who's more at risk for serious illness from COVID-19 because of age or other health conditions. High-risk events where the virus has been spread to large groups of people, again, it includes wedding receptions, funerals, bridal and baby showers, birthday parties, and even holiday parties. If you attend one of these types of events, consider quarantining afterwards to monitor for any symptoms that could develop. And if that happens, you need to get tested and stay home until you get your test results back. And if you're a healthcare worker, a teacher, or other type of essential worker, please be vigilant about protecting your health in everything that you do, both at work and especially when you're outside of work. There are also everyday changes we can implement within our own lives and families that will make a difference. Minimize your time away from home as much as you can. If you have guests in your home, limit the numbers so that everyone can maintain social distancing. Postpone celebrations or vacations until a safer time. The decisions, again, each of us make over the next few weeks may impact someone's life. It's up to all of us to determine if our actions will protect someone or put them at risk. This is the time when personal responsibility also means personal sacrifice, and we can do this. It's worth it. You are critical to keeping our state moving forward. So before I close too, I want to remind Iowans that the Test Iowa sites will be closed for Veterans Day tomorrow. I know there's high demand for testing at this time and that appointments are filling quickly. But I want to remind Iowans again that there are many, many options for testing, including a doctor, clinic, pharmacies, stroke detection clinics have sites available. So if a Test Iowa site near you is full, please seek out another option so that you know if you have the virus as soon as possible. And if you do, again, follow your isolation as directed by public health. And with that, we'll go ahead and open it up for questions.
Governor, in the past, you've said when you've been asked about a statewide mandate, you said there's no way to enforce that. How will you enforce this 25-person requirement for masks?
So it will continue like everything within the health declaration. If it's not enforced, it's a simple misdemeanor. And again, we've asked our police department, our officials to help us enforce that. But that includes educating, informing, and as a last result, issuing a misdemeanor. So actually, so they'll continue the same practices that we've had all along. And in addition to that, the DIA, the Department of Inspections and Appeals and Alcoholic Beverage Division will also be responsible, like they have all along, for enforcing the regulations at our restaurants and our bars.
Why couldn't they have done that on a statewide basis?
Well, we're targeting, I'm asking for personal responsibility. The mandates that we put in place right now are targeted to where we're seeing potential spread. So we believe that that's the right action to take at this time.
Governor, you noted that in Iowa, there's still a lot more activities that people can do than they can in other states.
Yep.
However, Iowa's per capita spread is much higher than it is in a lot of other states. How do you square those two things, and why not take
Well, we're
extra measures?
testing a lot of individuals, so we're watching it. We're working with our hospitals on a daily basis. And so I've said at this point, we're putting in additional mitigation efforts. They are targeted to where we're seeing the spread take place, and that is with smaller gatherings. It's with people are just, they're just becoming very relaxed because we've been dealing with it for so long. And so they're not taking the precautions maybe as like they were before. And so you start to let down your guard when you're bringing friends and family together. And so we're limiting the number of indoor activities to 25 people, outdoor activities to 100. If you want to go beyond that, then everyone in the facility needs to be wearing a mask, 2 years and older. We need to still practice social distancing. That's important to continue to do that. And we're going to continue to reevaluate on a daily basis. So this is where we're starting those additional mitigation efforts where we're mandating the mask is in effect until November 3rd. And as I said, we'll continue to evaluate every day and see if there are additional measures that we need to take. We can't continue to see the number of individuals hospitalized. It is about workforce and it's about capacity. And we need to make sure that we're doing everything we can as a state and as an Iowan to make sure that we're doing the simple things that we've talked about from the very beginning. And that's staying home when you're sick, washing your hands often, wear a facial covering if you can't social distance, and limit your trips. And if we all do that and really buckle down, hopefully we'll start to see we'll see the positivity rate go down, and we'll start to see our hospitalizations go down too. Again, we're working very closely with all of our hospitals. I said what the percentage is of the census that's due to COVID and then primarily COVID, but we have seen those tick up over the last week. And so we want to see those go back down, and we want to continue to work with the hospitals. They have surge plans in place, and they're managing and adjusting, but we're putting an extreme amount of pressure on them, and we can eliminate and reduce some of that by really taking very simple steps that can have a big impact.
Governor, why 25 people and 100 people? I mean, you mentioned that small gatherings are driving the spread. The
Yeah.
White House Coronavirus Task Force in its reports this week, in recent weeks, have warned that gatherings outside of your household are really driving up the spread. 25 people is still a lot.
Yeah.
I mean, we're coming close to Thanksgiving
Yeah.
here.
Well, we're still
What is the
asking people
message
to
there?
be
I mean, why not
responsible.
fewer people?
Yeah, well, it's a good place to start, and we'll take a look at it going forward. We took a look at a lot of different numbers and where we felt that we could be impactful. But in addition to that, Caroline, we're asking people to be responsible. So think about who you have over. Think about individuals that are vulnerable in your family. Think about, how your actions have an impact on hospitals and businesses and schools. And so right now, we have said that for indoor activities, 25 and over, you have to wear a mask and you have to social distance. I would say practice those 25 and under, but anything over that, there is a requirement to have a mask, social distance if you're 2 years and older. Outdoors activities, it's 100 and over. Again, they can be outside. They are to social distance. That it's not a mask versus social distancing. It is both. And we can have a larger venue than that if they adhere to the requirements of wearing a mask and social distancing. Again, with youth activities and high school sports, we want those kids to still have the opportunity to participate because we think that it's good for them. But, those are pretty tight quarters when parents and grandparents and family members come. And so therefore, we're going to allow them to go ahead and participate in sports, but we're going to limit the spectators to 2, and you still need to social distance. And so we'll see what happens. We're going to continue to look at the numbers, and we meet daily with public health and the team in my office, and we're assessing where we're at, and if we have to do more, then we'll move forward with that. This is a place to start, and it's progress from where we were.
If I could
Was
just
there a
follow up
specific-
really quick.
Well, I'm going to get to somebody that hasn't asked a question yet, and then we'll circle back.
Governor, Test Iowa is getting some criticism because of the lack of appointments this week. There was talk about doing some more metro sites. Is that something you can talk about? Will there be more facilities where people can go?
Yeah. So actually with Test Iowa, I'm going to just give a little bit of a history and talk about what we're doing. It's incredible, the capacity that we've built into that. So right now, we started with Test Iowa and our goal was to do 3,000 a day, and we've doubled that. We have the capacity right now to do 6,000 a day through the State Hygienic Lab with the Test Iowa lab, which is downstairs. Yesterday, they hit an all-time high, and they ran through the lab 6,203. And that is just the Test Iowa sites. So we continue to increase the number. They brought the numbers down a little bit because of the holiday, and we didn't have the lab, and we don't want people waiting on results. So we wanted to make sure that we would meet that expectation. I had some information here, I can't seem to find it. But overall, I'll give you an example too of just the sheer volume that we're testing with when you take a look at everything, not just Test Iowa and clinics, but all of our capacity to test in the state of Iowa. From November 1st to the 7th, we tested 160,146 Iowans, which equates to about 23,000 Iowans a day. So we continue to look for opportunities to build that out. And then, okay, so our current capacity with the kind of the rollback with the holiday was 2,470. Yesterday, Todd, we built into some capacity to that. So we have the capacity now of doing 3,040. And that went into effect yesterday, so we bumped them up. And then we are winterizing, so we're making some adjustments there. But with the way that they've set it up inside, we still believe we'll be able to meet the capacity that the State Hygienic Lab has. So just remember, though, but if you can't get a test through Test Iowa, there are multiple other sites, your doctor, your clinics, your pharmacies, the stroke detection clinic centers. I mean, there are the antigen test. You can buy a test at Costco. I mean, there are a lot of options out there, and we'll continue to build that out. So Iowans, I think we've tested 1 in 3. Our numbers, when we look at every type of test that we're utilizing, we are way at the top in compared to other states.
Governor, is this a de facto mask mandate for schools?
Well, we kind of, so we're trying to incentivize it, Kay, so I think we already sort of did that for kids, because when I was talking to superintendents, we were asking what are some of the issues, what's working, what's not, and what I was hearing as we talked to superintendents across the state is if they weren't wearing mask at that point, and a child tested positive or a teacher, then they would have to quarantine the entire classroom. And what they were seeing out of the numbers that were quarantined, they weren't having any positive cases come out of that. Now, a lot of them were already wearing masks, but the numbers really showed that there wasn't a lot of transmission between the kids, and those kids being quarantined, the continual disruption of being out of school and back in school was causing problems for them and just administrating all of it. And so we worked with Dr. Padati and other states, and that's when we said that if everybody is wearing a mask in the classroom, then you don't have to quarantine. Now, if you don't abide by that, then the old procedure stays in place. So it was an incentive to say if you don't like the disruption and it's hard for families. And what I heard from parents and what I've continually heard from parents is they're okay with the mask. They want the kids in school. They think it's really important for the kids to be in school. So we're trying to figure out ways that we can do that. As far as the sports, it's just one more, that's a way for us to continue to let them participate. But to just say, I can't have a gym packed with people and not take a chance on them not wearing a mask or not social distancing. So the way that we can address that right now is to limit those numbers to 2 spectators, and then we'll take a look at it. I don't know if I'm answering your question.
The question is, if you look in a school hallway, that's quote unquote a room perhaps.
Yeah.
You have more than 25 students in there if the school district doesn't currently have a mask
No, it doesn't
mandate.
apply. These are I misunderstood what you said. These are for social, this is for social gatherings, and so that the school would be outside of that.
The 25 number.
Yeah,
Okay.
yeah, I'm sorry, I misunderstood your question. So it's for social, community, recreational, leisure, or sporting events. So that's completely separate, so I'm sorry.
Does that include like a Thanksgiving holiday celebration, like that?
Yeah.
Okay.
Yeah.
May I ask you a question?
Yeah, yeah.
So I've talked to public health professionals in the counties, county
Yeah.
level administrators in the last few days.
Yeah.
And they tell me that it's not really just COVID fatigue, but it's people don't believe masks work. People don't believe COVID is that serious of an illness because they've known a lot of people that have got it and just
Yeah.
simply gotten better.
Yeah.
So there's a lack of belief of the seriousness of the level of this illness in our society. So I'm wondering what you do it just seems like a public service campaign is not going to change hearts and minds on that point. I commend you for the actions today, but I mean, if people aren't willing to really believe this is that bad, what do we do?
But some of that goes into pandemic fatigue. Some of that goes into a lot of individuals, people, to your point, that have had it and recovered. Our president did that. So I'm here to tell Iowans, I need your help. If you want to keep our businesses open, if you want to keep our kids in school, if you want to make sure that we have hospitals and long-term care facilities, and we have clinics that can treat not only COVID patients, but that they can treat other individuals that have serious health conditions that need to go to the hospital, then we all have to buckle down and take this serious. It spreads. It's very contagious. And so we need to all do our part. And I hope Iowans take that heed, because I have tried to be very mindful of not only protecting lives, but livelihoods by trying to work with our small businesses. I talk to them all the time as I travel the state, and some of them have indicated they don't know if they can survive another shutdown. So my message to them when they say that is to help us keep it open. Help us help us by doing your part. Talk to your family members. Talk about what we all can do to help us bring down the numbers and really help bend the curve so that we can protect all of the instances that I just listed, our hospitals, our schools, and our businesses. We can do it. And then, David, we are doing a significant PSA campaign. I'm really excited about the individuals that I've had to come in and be a part of that. It's, we've got just a lot of different personalities that people respect, admire, and identify with, and I think that will help also. We're doing print in local papers. That's how a lot of our rural communities get the information, and we're doing radio. So I'll be doing radio, we'll be doing television, and we'll be doing print to really just do everything we can to say, help us get this thing under control, and let's really buckle down, and let's see where that takes us, and hopefully we'll start to see the kind of bend and the containment that we're hoping we will. And if not, we'll have to sit down with the team and we'll have to evaluate what we need to do next.
Governor, what are PPE and staffing levels looking like specifically at hospitals across the state? Unity Point in Des Moines over the weekend saw a 25% increase in COVID cases and are starting to have staffing concerns. So what are they looking like statewide here in Des Moines? And also, will the state be offering any additional support to these systems?
So, we're monitoring that on a daily basis and working with them. We ask if PPE is an issue right now. They're not telling us that it is. It is truly workforce. So even with surge plans that we have in place, if you don't have the workforce to maintain the individuals or the level of acuity, then, it doesn't matter. And so that's one of the reasons that we helped allocate the $25 million, I think it was, to help with some of the incentives for the workforce that have just really been the unsung heroes from day one, and to help our hospitals retain and recruit and get the workforce that they need to manage the numbers that we're seeing. And if we need to do more, we'll take a look at that moving forward. They were all very, very grateful for that allocation of CARES dollars to help not only, thank our workforce that have been working on the line from the very beginning, but to also, again, look at opportunity to bring additional workforce in, and then to be competitive, because every state across this country, and especially in the Midwest, are experiencing the same kind of numbers that we are, and they're experiencing healthcare workforce shortages. So, I don't know, Kelly, is there anything that you think that we need to add to that you want to add?
I think the only other thing I add is that we are having a number of different conversations with companies that find and locate healthcare professionals, and really thinking through the other operational levers we can pull to make sure we can find them, get them in quickly, not ever compromising quality, but really just leveraging that availability and constantly getting back out there to talk to people on the ground about what that barrier is, what's the real constraint in real time. We have nurses, and I leverage our DHS experience on running facilities that pick up extra shifts. So how do we both maintain that safety and know where they are in case there's an outbreak in the facility, they're picking up an extra shift, but kind of how do we spread that resource at the community level?
We're going to take 2 more questions. One more from this room.
I have a follow.
Governor?
I have a quick follow-up, if I
Okay.
may.
Yep.
The quick follow-up is, I want to make sure I understand the mask issue that you raised. Is it all 99 counties or just the worst?
No, it's all 99 counties, but
Okay.
it's targeted to those
Okay.
indoor, outdoor,
Okay.
youth.
And will this pertain to the legislature in January at all?
No,
Okay.
they have to make their own decision.
Governor, the new proclamation doesn't have any capacity limits on bars or restaurants. You shut down bars in August because you acknowledged they were super spreader events. I'm wondering, when we have a surplus in the state budget of $300 million, our cash reserves are full, our emergency funds are full, why not temporarily close those to slow down the spread and give the small businesses help from the funds that either CARES Act or state dollars to keep them afloat? What is that at all consideration?
Well, first of all, you have to remember that while we don't have a capacity, they still have to social distance. So that basically means they have to have 6 feet between each table. In addition to that, they have to be seated. This is new restrictions. They have to be seated at the table when they're at all times, except for go to the restroom or for limited activities. And when they do that, they have to practice other measures. In addition to that, we've limited the number of groups. So it can only be 8 at a table unless it's a household, and then it can go, above that. We didn't want to separate families because they're living together. So they really are already still, and we've added some additional to that. And like I said earlier, we'll take a look at it. But what we're seeing, if we need to make additional adjustments, we will. But I remember you asking me a question not too long ago, Governor, what are you going to do about these small businesses that are finding their livelihoods being shut down when I was shutting down the bars? What about the impact that it has on those businesses? And they're reaching out to me and saying, this is my livelihood. I've worked, my whole life to buy this business. Do you remember asking me that question? So I have to balance all of that. I have to balance the health and safety of Iowans, and I have to balance the livelihoods, and I have to take a look at other aspects as well that we always lose in the context of talking about COVID-19, and that is the increase in substance abuse, the increase in suicides, the increase in mental health issues. They are exponentially increasing because of the isolation and what we're dealing with COVID-19. And so we have to always be mindful of that. And that's going to be a lingering effect of COVID-19 that we're going to have to be mindful of as we move into this next legislative session. And we should never lose sight of that, ever.
Governor, Joe Biden is likely to do a federal mask mandate. He's not just announced theirs. I know you said that you did not want to, but I'm curious, how can the president-elect commit to issuing one, and do you believe he is the president-elect?
You kind of sound like you're underwater, but right now, we'll wait until all that takes place. Right now, we're putting mitigations efforts in place that we believe will be impactful. And again, if we need to do additional steps, to take additional steps, we will at that time. So thank you.